Hello. If we're going to talk more in depth today about upper cross syndrome, we first need to think in the following way. And the very first thing you must remember is to know clearly which muscles are tight and which muscles are weak. When we start discussing the tight muscles, we should ask ourselves what was their original function and how has losing a part of that function caused a mechanical effect on the body. This effect won't be mild if we just leave it like that. So, the first thing we will talk about is the tight muscles. The tight muscles, like upper trapezius and levator scapula and pectoral muscles and sternomastoid muscle. Firstly, we will talk about upper trapezius. Normal function of upper trapezius elevate and upward rotate the scapula, helps to maintain shoulder stability. What is biomechanical issue when upper trapezius is tight? It pulls shoulder toward the air, like you are constantly saying, I don't know, even when you actually don't know. This causes over elevation and contributes to neck tension and headache. Secondly, we will talk about levator scapula. Normal function, elevate scapula and rotate the cervical spine to the same side. Biomechanical effect when levator scapula is tight, pulls the scapula into elevation and downward rotation, limiting normal scapular mechanics and increasing neck stiffness. Other tight muscles in upper cross syndrome, pectoralis major and pectoralis minor. Pectoralis major, normal function, flex and adduct and internally rotate the humerus. What is biomechanical effect when it's tight? Draw the shoulder forward, protraction, contributing to rounded shoulder and restricted shoulder extension. Okay, what about pectoralis minor? Normal function of pectoralis minor, stabilize the scapula by drawing it in anteriorly and downward against thoracic wall. Here, it is attached to cricoid process. What is biomechanical effect when it's tight? Causes anterior tilting of the scapula, anterior tilting of the scapula, and the protraction of it, leading to impaired scapular kinematics and reduced thoracic extension. We will talk about sternomastoid, huge muscle and a huge role in the body. Sternomastoid function as a primary neck rotator and flexor, facilitating contralateral head rotation and neck flexion during bilateral contraction by both right and left sternomastoid. Anatomically, it divides the neck into anterior and posterior triangles and protect key neurovascular structure, including the cervical plexus. What is pathomechanical effect of upper cross syndrome on the sternomastoid? Firstly, tight sternomastoid limit contralateral rotation to the other side. When side bend to the left, it will contralateral rotate to the right. And also forward flexion, while its compensatory overactivation during head movement increases stress on cervical joint. Posture dysfunction, tight sternomastoid contribute to forward head posture, the worsening of upper cross syndrome, and cervical hyperlordosis, aggravating neck strain and discomfort. We talked about tight muscles, the final shape of your neck will be forward head posture, like that. It is the ideal posture and it is the bad posture. We will talk about the weak muscles or inhibited muscles. Firstly, we will talk about serratus anterior. What is normal function of serratus anterior? Serratus anterior hold the scapula against thoracic wall and assist in upward rotation of the scapula during arm elevation. Biomechanical impact when it weak lead to scapular winging of the scapula, impaired smooth scapular movement, and reduces the efficiency of shoulder elevation. Rhomboides minor and rhomboides major. Normal function, retract the scapula. When it weak, allow excessive protraction, the reverse of the scapula, contribute to rounded shoulder and poor scapular position. Final muscle, deep cervical flexors, mainly longus capitis and longus colli. Normal function, stabilize the cervical spine and maintain neutral head posture. Biomechanical impact when it weak, inability to control proper head position, lead to forward head posture, increasing stress on superficial neck muscles and cervical joint. Finally, lower trapezius, depress and stabilize the scapula, assisting also with upper trapezius in upward rotation during arm elevation with serratus anterior. Biomechanical impact when it weak, reduced scapular stability and poor control during shoulder movement, contribute to abnormal scapular kinematics and potential shoulder dysfunction. Here, lower traps, as we said, biomechanical impact reduce scapular stability and poor control during shoulder elevation. Quick recap about tight muscles. What is tight muscles? Firstly, sternomastoid, upper trapezius, pectoralis major and minor. What about weak muscles? Deep cervical flexors. When it weak and these muscles are tight, contribute to forward head posture, bad posture. Rhomboides also, major and minor, middle and lower trapezius. Thank you.